Hi, my name is Dr. Regina LaRocque. I am a board member of Sustainable Wellesley and a resident of Wellesley. I am also a board member of Greater Boston Physicians for Social Responsibility, and I'm an infectious disease physician and researcher at Mass General Hospital. And I've been doing these videos in order to talk to people in my community about what's happening with the coronavirus epidemic. And today is Sunday, April 5th, and so I'm here to answer some questions and offer some thoughts. I wanted to start by just talking briefly about a really important concern about what is transpiring with the epidemic currently, which has to do with the kind of patchwork of different responses we are seeing in different parts of the country, as well as even within our own communities across Massachusetts. When you have an infectious disease outbreak, the events that transpire in one location are very intimately tied to what happens in other locations, because at this point people are still moving around. So we are really only as strong as the weakest link in the transmission chains that are occurring right now. And there are significant numbers of weak links in many places across the country. And one of the most disturbing things we are seeing now in Massachusetts is the fact that some of our poorest communities are the ones that are being most hit by the epidemic. The Department of Public Health has not really per se released geographic data, but there is reporting, and I refer you to Patch, looking at cases by community, and we see that the communities that are least economically affluent are the ones that are suffering the most right now. And this is very consistent with what we're seeing in the hospital setting as well, where our most critically ill patients are also the most fragile, the most economically disadvantaged. And so I just want to talk for a minute about why that might be the case. I think that, unfortunately, it's turning out that social distancing is becoming a social determinant of health. People who were able to quickly adhere to the social distancing advisories are the ones who are faring better at this point. And I think as a person who lives in an affluent community, I'm aware that many of us were able to begin to work at home immediately. We were able to pay our bills, and we were able to understand the directions that were being given in English. But for many people, this is not the case. Many of our neighbors and friends and colleagues could not afford to stop working, since a lot of work is listed as essential. They were not allowed to stop working. And that has put them at risk, their health at risk, and it has put the health of all of us at risk. We're seeing that people who work in grocery stores, people who work in food service industries, these are the people who are getting sick now, and they are getting very sick. And this is a threat to the health of all of us. If we have not protected the most vulnerable communities, we are not protecting all of us. I think we're very fortunate here in Wellesley that our town leadership took some aggressive early moves to shut things down in town, and I am very grateful to them for that. But many communities did not have that luxury. People who do landscaping, people who work in grocery stores, people who provide house cleaning services. These are people who were not able to stay at home. And these are the people who are now getting very sick. we have a responsibility to ensure that everybody in Massachusetts is able to protect themselves and protect all of us by adhering to the stay-at-home advisory. And I think the fact that it's an advisory rather than an order has allowed people to, or forced some people against their will to have to continue to work in circumstances that are putting them and all of us at risk. An important concern is immigrant communities, and I want to share a letter that a number of us wrote to Governor Baker this weekend on that topic, because I think it's very important for everybody to understand this. So a group of us wrote the following. We are healthcare professionals with expertise in infectious diseases and community medicine, and we support Governor Baker's bold initiative to scale up COVID-19 contact tracing in conjunction with partners in health. But we fear this initiative will fail unless the Commonwealth institutes a moratorium on immigration enforcement. Contact tracing in a democratic society depends on trust. In countries like South Korea, public health officials can depend on their at-risk communities to help identify and report new cases. Unfortunately, immigration surveillance and other forms of immigration enforcement have destroyed that trust for many of our most vulnerable communities in Massachusetts. Long before COVID-19, healthcare providers and advocates pointed out that fear of ICE enforcement and surveillance prevents immigrants from seeking medical attention. Recent implementation of the public charge rule and executive orders increasing ICE presence in certain areas have only made this situation worse. Many of our patients fear that by accessing healthcare and social services, their chances for obtaining permanent legal status will be negatively affected. Many others fear the uniformed security officers and police who are to be found in and around clinic entrances and emergency rooms. Now, in the midst of the COVID-19 crisis, that chronic injustice has transformed into an acute public health threat. The reason is biological, not political. It is a basic principle of infectious diseases that when a sizable fraction of a population is effectively excluded from infection control measures, those measures will not succeed. This situation is not only unjust, but from a medical and public health perspective, it is dangerous for all of us. Immigrants and their families need to know that it is safe to seek medical care if or when they need it. They need to know that if they become ill with COVID-19 and require isolation and treatment, they will be cared for and not punished. Until this is the case, all of us will remain at increased risk. Our elected officials should address this problem quickly and forcefully. While states do not directly control ICE activity, Governor Baker should join with other state leaders in calling for an immediate moratorium on all immigration enforcement, including arrests and detentions, at the very least for the duration of the COVID-19 emergency. Permanent changes, including pending state legislation like the Massachusetts Safe Communities Act, that would free police and court officials from having to inquire about immigration status. Governor Baker should publicly endorse this bill and commit to signing it immediately upon passage. Once such policies are in place, they must be publicized widely in immigrant communities. The Baker administration should act in concert with municipal agencies and community leaders, churches, hospitals, community health centers, and the media to provide clear and welcoming information on how to protect one's family, contacts, and the public at large from infection. Immigration enforcement exacerbates the COVID-19 crisis. To protect the health and safety of our Commonwealth, it needs to be halted, and time is of the essence. This is gasoline on the fire, and we have to protect our immigrant communities. Here in Wellesley, I see that many lawn care workers are being subjected to having to come to town packed into trucks. This is unjust. We need to support these communities financially and not force them to come to work. I would suggest that if you want to find a community in Massachusetts that you want to support, identify a way to provide funds to the community. There is a One Chelsea fund now for residents of Chelsea. Lawrence is another community that is severely affected at this point. There's many things we can all be doing to support those communities, but the most important thing is not making people do work that is non-essential. It is a risk to all of us. I think I'm just going to answer a few questions here that I have. So this one is about transmission. We are told to keep 6 feet away from other people, as droplets expelled from coughing or sneezing can travel 6 feet or more, according to a recent MIT study. I was wondering if droplets expelled from exhalation can travel as far. When we walk by another pedestrian or jogger or biker, can they leave behind them a trail of droplets? Well, I think these are important questions, but to be honest with you, at this point, the recommendation is to cover your face with a cloth mask when you are out. That is in order to prevent any concerns related to people who might be transmitting virus before they're symptomatic inadvertently. And so regardless of how far the droplets may travel or whether some people may be able to aerosolize virus, if we are all wearing facial and so we should all be pursuing that. I haven't really seen it penetrate significantly in the time I've been looking at this yet. So I'll just say that I think it is a move that we all need to make. You know, importantly, we need to be sure that everyone has access to this. I think one of the reasons for universal facial covering is that then the stigma becomes attached to the person who is not wearing facial covering. And that is kind of an important social factor. I read that having dry, cracked skin on your hands can allow COVID-19 to enter through cracked skin. Well, I don't know the answer to that one. I will say that in general, having your skin is a very good barrier to any type of it's a fantastic barrier to infection. And so anybody who has cracks in their skin is always more prone to have problems. I don't think that relates directly to the COVID-19 situation, but I think nowadays when we are all washing our hands a lot, I think it's probably good to keep your hands from cracking. I'll do one more question. I read that COVID-19 can survive in the intestinal tract for 37 days, so that patients' lung swab might be clear, but virus could still be shed from the intestines. Does this mean that bathrooms with toilets that don't have lids could be spreading infection? Well, I think clearly there's a lot of questions about which parts of the body can shed virus and for how long. And this is something that we're still sorting out. I think virus certainly is detectable in stool. We're trying to understand more about how much virus is detectable in the nose versus in the sputum. I think the bottom line, though, is not to be distracted by some of that from really the most fundamental things that we all need to be doing, which is the social distancing and the covering of the face and the frequent hand washing. I think that even if it turns out that transmission through stool or other body fluids is a factor, I think at this point in the game it's not a big factor, and we should not lose sight of the things that we really need to be doing all the time, which are washing hands, not touching your face, and now covering your face with cloth. This is my first time trying to answer some of these questions that pop up, so I'm just going to see if there's anything here. So I think I wanted to just be brief tonight, and I want to focus us really importantly on the topic of who are the most vulnerable people in Massachusetts and what we can be doing to protect them. And so I think that I just want everybody to understand that even though the data are not out yet from the Department of Public Health, we have hotspots of COVID in Massachusetts that are centered on our poorest communities. And we have a responsibility to change that dynamic quickly for the health of all of us. And the things we can do are to support those communities financially so that they can enact the same public health actions that we have done in our town. We need the definition of essential work to be much more restrictive than it is. I see lots of people from poorer communities doing work that I would not consider to be essential in this moment. And we should recognize that protecting the health of those communities is also protecting our health and is the right thing to do. So I will end by saying, as I said before, that I'm just here expressing my own personal insight into the situation. I don't represent any of the organizations that I am associated with. And I think it is really important for everybody to seek out good sources of information. And I refer you to the CDC website for a video of how to make a cloth facial covering, as well as to the Mass DPH in the town of Wellesley. Things are moving very fast, and what you see in the news at this point, I think, is probably going to be representing the situation on the ground from 2 or 3 days ago. The Boston Globe had an excellent piece today, which is Sunday, just describing the situation in Mass General, and I think that it's a fair description. And I am confident that other hospitals around Massachusetts are similarly experiencing a overwhelming surge of very sick people. Our hospitals are filling up, and we really are projected now just to be at the beginning of a surge week. So there is a lot of concern about what things are going to look like in the coming days in terms of our capacity to keep up. So I thank all of you who are adhering to the stay-at-home advisory, and I encourage you to do all that you have within your power to be sure that our neighbors and friends and individuals who may not be as fortunate as those of us in Wellesley are able to also adhere to the stay-at-home advisory, and contact your legislators. So thank you very much.